Good afternoon, everyone. On behalf of the Ohio First Steps for Healthy Babies, Ohio Hospital Association, Ohio Department of Health, and our other partners across the state, we're excited to be hosting the first of our 2017 First Steps educational calls and webinars seeking to promote and support breastfeeding in the state of Ohio. My name is Ryan Everett, and I serve as the Director of Population Health here at the Ohio Hospital Association, as well as co-lead the First Steps program. I'm joined today by my co-lead from the Department of Health, Bree Haplin, who many of you know and have worked with. We're also lucky today to have our facilitator for the call, Jennifer Foster. There are also many great folks around Ohio who are on the call today who help to support the First Steps program, and we certainly wouldn't be here today without all of their great work. Before we start the call today and we introduce our speakers, I wanted to go over a few quick housekeeping notes. This call will be recorded today, and we will post that to the First Steps webpage when it is available. Please feel free to share that in the slides with any of your colleagues who may not have been able to attend today. All of your lines should be muted when you enter the call today. So if you may have joined and automatically hit the mute button, you may have accidentally unmuted yourself. We'll try to make sure everybody stays muted during the call. During the Q&A portion, if you would like to ask a question, you can hit #6 or unmute yourself through the Zoom platform, and you can ask a question that way. There's also a chat box function. You can use that as well to chat in questions throughout the session today. We will do a Q&A session here at the end. So without further ado, I'll go ahead and turn the call over to our facilitator today, Jennifer Foster. She's an international board certified lactation consultant with hospital-based experience with the Summa Health System in Akron, Ohio. Additionally, she is a registered nurse with experience in postpartum care, special care nursery management, teaching, and research. So I'll turn it over to Jennifer.
Hi, thank you, Ryan, and thank you everybody for joining the call today. We're so pleased with all the interest across the state in this program. This call is to establish a forum for coaching on the 10 steps, as well as to provide an opportunity for everybody to network and assist with meeting the 10 steps. I'd like to go ahead and introduce our speakers today. We are very grateful that Coe Bell from Cleveland Clinic has agreed to speak on our topic today, which is improving exclusive breastfeeding rates. Cleveland Clinic has been very successful in this, but Coe Bell is the Assistant Director of Childbirth and Education and Lactation Services for the Cleveland Clinic. She graduated with a BSN from Langston University. She received her master's in nursing from Walden State University. She has Coe has a passion for helping parents get the best possible start, and she has presented programs for staff and physicians on topics including improving breastfeeding outcomes and the Baby-Friendly Hospital Initiative. Coe is the current Ohio Lactation Consultant Association President. She is also chair of the Cleveland Clinic Regional Baby-Friendly Hospital Initiative Consortium, and she received a Lifetime Achievement Award in 2016. So thank you very much, Coe, for agreeing to be with us today, and we look forward to hearing your presentation.
Thanks so much, and I'm really excited to be able to share with all of you. Next, please, Ryan. I have no financial disclosures to share, and I want you to know that I'm committed to improving population health through the promotion of breastfeeding. Next. The objectives I set for us today are that you would be able to name 2 key ways to gain administrative support in your lactation quality improvement initiative, that you'll be able to identify and plan implementation of 3 cultural changes essential to move your staff to embrace the 10 steps to successful breastfeeding, and that you'll be able to name 2 recent tools that support avoidance of overfeeding and non-medically indicated formula supplementation by the time we're finished. Next. Just a little bit about my experience. I've been with the Cleveland Clinic since 1999. In 2007, a grassroots group got together and discussed the possibility of moving toward baby-friendly designation. There were 6 hospitals included in these meetings, and all from level 1 to level 3 facilities. We spent 5 years working together, consolidating our policies and practices, collaborating, and we actually have now designated 4 hospitals baby-friendly, and we're preparing for the redesignation of 2 of our hospitals. Next, please. So I was so excited when I learned of the Ohio First Steps program. I just thought of how important this is in helping hospitals gain the momentum they need to work through the baby-friendly initiative. So congratulate yourselves on being here. Get ready to work hard and anticipate challenges. You'll want to recognize your champions as you move forward and share positive patient feedback with your administrators. Celebrate the journey as you go forward because it is a challenging journey and well worth the effort. Next. So the Ohio First Steps program is based on the 10 steps to successful breastfeeding from the World Health Organization and UNICEF. Hospitals are awarded based on a 5-tier system, so every 2 steps that you achieve, you are awarded a step. Hospitals are free to choose the order of steps to adopt, and that said, it will be important as we move forward to think through the steps you're taking on. Next. The CDC research on maternity care practices recently discussed institutional changes in maternity care practices that effectively increase breastfeeding initiation and duration. And research has shown that there is a relationship between the number of baby-friendly steps and breastfeeding success. Hospitals that have no steps achieved are 8 times as likely, mothers are 8 times as likely to stop breastfeeding before 6 weeks as moms who stayed in hospitals that followed at least 6 of the 10 steps. We see greater patient and staff satisfaction the more steps that are achieved. And that came from research by Meyer and Turner-Maffei in 2008. Next. So how do we go about changing the culture of our maternity care? Next. We are upending traditional care. Birth over the past 70 years was medicalized to a point that basically caused us to fail mothers at helping them establish breastfeeding. Formula companies pursued business and have used us as their marketing agents for 70 years. Next. We as nurses and our providers have been well-meaning. We wanted to help mothers get sleep at night, and what that did was to send them home not knowing how to care for their infants, with problems with engorgement, babies not latching, and much supplementation, which caused milk supply problems. We unwittingly caused mothers to fail at breastfeeding for so many years. Next. I believe that the 10 steps to successful breastfeeding is the answer to improving exclusive breast milk feeding. It improves infant transition, nursing workflow, bonding and attachment. It improves our feeding outcomes. It helps moms meet their goals for breastfeeding. It improves maternal self-efficacy, and it raises patient experience scores. Next. One of the important things when starting to work on exclusive breast milk feeding is to gain support from your administration. So I encourage you to identify respected champions in your organization and leverage their influence. Look for OB or pediatric medical chairs, your director of quality, if you're a magnet hospital or a magnet pathways hospital. Make sure that they understand that this is a nursing-led initiative and that it is very much a part of any magnet or pathways efforts. You want to gather evidence from respected entities and leverage the CDC, the American Academy of Pediatrics, the Ohio Department of Health Maternity Licensure, and the Joint Commission. All of these respected entities have much resources and evidence that will support your efforts. And I have an extensive list at the end of the presentation with many of the references that I've utilized over the past 10 years for your use. We want you to cite high-level studies and proven research outcomes. Look for Cochrane studies and studies that have are more of a conglomeration of research studies that have proven results. So you want to make sure that you translate your health outcomes to healthcare dollars saved. This is one of the things that was so hard for me to understand, that in order to gain administrative support, especially in this day and time of trying to understand how to make healthcare more affordable, you have to talk to them in terms of dollars and sustainable care. You want to talk to them about reduced possible future hospitalizations. We know that 25% of infant admissions in the first year of life are due to upper respiratory infections that might be reduced through breastfeeding. Potential healthier populations in the future. It's an investment in long-term health and wellness improvement. And also in the hospital workforce, breastfeeding can prevent reduced loss of wages and productivity in the workforce. And just remember that we want to first do no harm. So we want to help prevent effects on the immune function of our newborns throughout life, reduce asthma and autoimmune disorders, and help with less feeding intolerance and expensive use of infant formulas by helping improve breastfeeding outcomes. Next. One of the ways that we got to our staff was by organizing a breastfeeding task force, and we invited our nurses from all shifts to participate. We wanted to identify obstacles on our mom-baby unit and promote practices that improved breastfeeding exclusivity. During this time, we had Maya Bowman, who's a well-known speaker in Ohio, come and do a session with our nurses on breast massage and engorgement. She also worked with our nurses on laid-back breastfeeding during the time, and it was very exciting for our nurses, well attended. We utilized thinking rounds, and we received input from all of our nursing shifts. We discussed barriers on night shift, rooming in, and we got feedback with the lactation consultants and nurses that we were able to take and build from. We also are using this to keep our staff up to date on improvement processes that we are doing. Next. This is a video from TED Talks, and I'm feeling like we probably don't have enough time today to watch the video, but I do want you to know that it is well worth watching, and it basically talks about the first follower. So a leader can be seen as kind of the lone nut of an organization, and the first follower makes the lone nut a leader. And then from that point on, the more people who join in, the third person creates a movement. And so I want you to utilize this and leverage the principles of the first follower in order to help change the culture in your nursing units. We did this by recruiting nurses who were informal leaders in our units to be the first to implement a new practice, such as infant weights in the mother's room at night instead of bringing all the babies into the nursery at one time and doing infant weights. This was a huge piece to helping reduce the separation of mom and infants in our units. Next. So assorted barriers that we found to exclusive breast milk feeding and just the changes of the culture were staff resistance to change, which is a given. Their comfort with the status quo. We had always done it a certain way, and we didn't want to shake it up. Product representatives continued to subversively reach our staff and our patients through mail and other websites and things. Sometimes our patients' cultural beliefs and ethnic beliefs about first milk, about the absence of milk, and the best of both, which is mothers who decide that they want their babies to have the best of both. So they want them to have formula and breast milk because they feel both have benefits. And this is, again, because of marketing. We have vulnerable populations, there are options for WIC, and extended visiting hours in our maternity units, social media, and the exhaustion that we see with our families. It's tough to find that teachable moment in short vaginal or cesarean length stays. Lack of provider support, which can be spoken or unspoken. Some of the most surprising opposition I've had has been through providers who didn't speak up, but I found out later really were not supporting our efforts. Next. So in order to avoid separation of moms and babies, we changed the name of our unit from postpartum nursery to our mother-baby unit, and have renamed the large nursing areas that we had our procedural nursery. We set the expectation from the start. We admit the mother and baby together from our birthing center to the mother's room, and all care is given to the newborn in the mother's room. The first bath we do during a teachable moment, so we're delaying baths to 12 to 24 hours and putting babies immediately back skin to skin at the end of the bath to rewarm instead of on a warmer in the nursery. The cribs are ready in the room, and we have worked very hard to identify reasons that babies were being separated from mom throughout the day. So all of our labs, weights, assessments, our vitals, the provider exams, medications, and injections are being done in mom's room whenever possible. And to that end, we actually are doing skin-to-skin during labs, meds, and injections for the newborns, and skin-to-skin and actually breastfeeding now. And our nurses are finding it much less distressing for our newborns when babies are skin-to-skin. Our head nurse in the nursery made a cart, and she escorted all of our pediatricians to the mother's rooms with all the supplies that they needed, otoscopes, ophthalmoscopes to do their assessments. We've looked at lighting and other equipment that the pediatricians felt was important, and all of our assessments, pediatric assessments, are done in the mother's room unless there is a serious health concern that might need to be assessed in the nursery. We teach parents how to soothe their infant, and we're using cue-based feeding to teach moms and dads about feeding frequency. Next. So this is just one page of a calendar that we made as we were preparing for a baby-friendly designation visit, and talks about no restrictions on frequency or length of breastfeeding. So we all have to get away from that, every 3-hour expectation. Babies cluster feed, and we count every cluster feeding as a feeding, and we let healthy, vigorous term babies sleep and wake for feedings. Next. Safety is always first. And we know that with the onset of rooming in, there nationally was concern over infant falls. And we want to make sure that we are observing, keeping in mind mothers who have been given narcotics, mothers who are exhausted and alone, cannot respond to their infant, and also just delayed transitions of the newborn. We want to document reasons if an infant needs to be taken to the nursery, mom's alone and can't respond, or she's excessively sleepy but refuses to put the baby in the crib, the baby's too fussy. We want to make sure that we document reasons to take the baby to the nursery, bring the baby out for feeds, or ask mom ahead of time to express some colostrum and give that with alternative feeding methods until the mom has had a nap and is a little bit better able to respond to her infant. Next. So set them up to succeed. Next. You want to educate your community. This was one of the things that we missed at the beginning. We forgot, we had support groups in place, but we forgot that we really had to get the word out to the community and help them think of breastfeeding as normal infant feeding. So we used on-hold messages, we did community forums, we went to churches and civic meetings, we did public relations spots and community publications. Our hospital marketing helped us with our website. You want to let your community know that you're providing best practice maternity care. And in doing that, offering post-discharge breastfeeding support by phone or outpatient support is really important so that once the mother goes home, she still has that support from your organization. You also want to make sure that you're teaching grandparents why infant nutrition recommendations have changed since they had their infants. And sometimes those are the mother's biggest support system. You want to bring your grandparents, your families, and the dads in and help them understand why it's important and why it's worth it for mom to establish successful breastfeeding. Next. We also participated in some community events, and we did the 5K Mother's Milk Run here in Cleveland for the last several years, and we donate the proceeds to Ohio Mother's Milk Bank. Next. We set up tables and we do education at those events out in the community. Next. We also, during World Breastfeeding Week, put public displays in the hospital and around so that the community, those in our cafeteria or out in the halls of the hospital, can see why breastfeeding is important in our community. Next. I think we skipped a slide. So are your physicians on board? We want to convert our naysayers, and there are still some in our health system, I have to tell you. We want to identify champions. They are our biggest advocates. We want to make sure that prenatal education is documented. We want to visit our prenatal offices and meet with their staff. And the tools that the Ohio First Steps program has provided, the flip charts of the 10 steps, our office staff was very excited to receive those, and we're really anticipating some improvement in our prenatal education because of what Ryan and Bree and the Ohio First Steps program has put in place for us. And let's talk to our physicians about the fact that 4 out of 5 women are choosing to breastfeed. So this is something that we want to help our patients achieve their goals. It factors into their patient experience and their satisfaction. So this is one of the ways to get your physicians on board. Next.
All right, and we're about halfway, just so you know.
Thanks, Ryan. Prenatal patient education is very, very important, and the Baby Friendly USA organization has said that it is one of the most difficult steps of the 10 steps. So if you haven't focused on this yet, it would be a thought process to get started on it. It is difficult, and so we want to make sure that breastfeeding is mentioned during prenatal patient visits, do mock surveys of your prenatal patients through the offices. We actually, in our at-risk population clinic, put a childbirth educator 1 to 2 days a week in the clinic and worked with our patients. Some were non-English speaking patients and a high-risk population. We provided handouts in their languages. We offered some small incentives for them to be able to speak back to the education we were giving them. You want to make these education pieces sustainable, and you know, when language barriers are present, you want to make sure that you're addressing that. Next. You want to send clear messages to your patients and your staff. If you haven't already gotten rid of your formula company discharge bag, it was much less of an issue than we were led to believe. There's not enough formula in there for it to be an issue in that way, and it is definitely a detriment to your services and your exclusive breast milk feeding. So we can help you with that. Teach the golden hour. Have childbirth educators and your birthing center staff talk to parents about putting babies skin to skin at the time of delivery and the protection of that golden hour that those parents cannot get back.
Ideas? Visit
hospital.com/healthspirations.
To avoid having large people with them during this time, so that they have privacy and can enjoy that skin-to-skin time and that bonding time as a new family. Teach mothers hand expression from the beginning. Latch in position. Next. Support rooming in. Rooming in is the second hardest step of the Baby Friendly initiative. So it's something that requires a good amount of staff education. It requires equipment to be able to manage care of the newborn in the room, such as scales and other pieces of equipment, bathing equipment. It changes routines, and it requires scripting with your staff. You want to provide effective staff and patient education, and the more effective the education is, the less you'll hear complaints from patients about inconsistent information. Next. Remember that until you have policies in place, you can't really enforce anything. So don't reinvent the wheel. There are some model policies available online. And also, if you look on Ohio First Steps and also on the Baby Friendly USA website, you can certainly find suggestions for policies. Use evidence-based resources and educate your staff on the changes to policies when you get them in place, and hold your staff accountable for their patient care, adhering to your policies. Next. So staff education, a lot of scripting we did throughout these years. Scripting on why rooming in is important, the fact that mothers actually rest as well or better with the infant in the room. Scripting on why we avoid pacifiers for breastfed babies in the first weeks until breastfeeding is well established. What normal breastfeeding looks like in the first 24 hours. And what we do with the non-latching term infant. Cue-based feeding, which is very important, and not to put limits on time and amount of feeding. And then avoiding non-medically indicated supplementation, how to speak to moms about the fact that sometimes infants fuss or root and still are looking for comfort more so than feeding. Anticipatory guidance, what to expect the second night, and planning for rest, the importance of rest, reducing visitors, putting a sign on the door that says, do not disturb, check with the nurse. Next. We also sent staff, we actually requested funds through a grant and sent some staff from all of our regional hospitals for certified lactation counselor training. So the more we educate our staff on the benefits of breastfeeding and the reasons for exclusivity, the better we can expect our consistency of information will be across the board. Next. So when we talk to parents about their feeding decision, we have to have in place scripting for our birthing centers. We want to ask patients about what their expectations are after delivery. And we also talk about who does formula risk education. So with looking at breastfeeding exclusivity and asking a patient their plan for feeding, we want to make the assumption that they are planning to breastfeed, because we know that at least 4 out of 5 mothers usually choose to breastfeed. But we also want to have nurses comfortable with discussing the risks of formula and the benefits of exclusive breast milk or breast milk feeding, and make sure that our nurses understand the importance of documentation, of the education and counseling with that mother on her reasons for her feeding choice and her informed decision. So it's that the mother's making an informed decision about her feeding choice. Next. This is an example of one of the boards that our lactation consultants made after our baby-friendly designation was announced. But you can see that we have information about documentation on the board, along with, if you can see the picture of the railroad tracks, we talked about getting on board with rooming in and the scripting that was needed for our staff with rooming in. We also had scripting on a couple of other topics. So, you know, about sleep and sending the baby to the nursery. So this was one of the ways that we were effective with staff education and expectations. Next. This is another board that the lactation consultants did. And one of our nurse educators actually does what she calls a redesignation reader. She has gone through the 10 steps, so now we're on step 8. And you can see our very proud Ohio First Steps certificate there. Maya Bowman's article on therapeutic breast massage, which we are working on with our nurses to help mothers with breast massage prior to hand expression. And one of our great LCs, Terry Balmer, does a lactation tip of the month, so that we can help our nurses get on board with and be more consistent with breastfeeding. Next. Skin to skin, how important is that? And we're doing it at the time of birth. We're also doing it through the postpartum stay. We prepare the patients during labor for what to expect, and we talk about those magical golden moments. We talk to them about that option for privacy, and we delay weights, length, eyes, thighs, and address barriers and challenges with our staff, so that we can help the family have that first hour. Next. So here are some tips and tools that we have found extremely beneficial. And probably one of the very most important things that happened for our health system was that at the end of 2014, one of our physician champions, who was at the time the quality director for our Women's Health Institute, contacted me and asked me if I was ready for a challenge. And I said, "What do you mean?" And she said, "We're going to set exclusive breast milk feeding as an enterprise, a Cleveland Clinic enterprise quality goal for 2015. This is going to be a big deal, and it is going to be reported throughout the Cleveland Clinic with every quality reporting period during the year." She set the goal, I felt it was a stretch goal, of 72% exclusive breast milk feeding. It achieved multiple goals. First, it was seen as a collaborative goal for obstetrics and pediatrics. It promoted affordable care, and it was a goal to improve long-term population health, and it certainly supported our baby-friendly designation achievement and maintenance. So exclusive breast milk feeding was set as one of our enterprise quality goals. So it included collaboration from nursing, obstetrics, and pediatric institutes. And the expectation was set that we would achieve this goal. But I can tell you that it really put strength behind this initiative. And the fact that it was seen as an enterprise goal gave it quite a bit of strength. And I think that the collaboration between all of our disciplines was much stronger because this goal was set. Next. One of the tools that we've been using for several years have been the Stanford guidelines. And what I found in the last year is that the original Stanford guidelines are no longer available on the internet, but that now there is a new set of guidelines from Stanford Medicine Newborn Nursery, and it's more comprehensive, I think, and more focused on different gestational ages, different risk situations, and in different levels of concern over infants, especially non-latching within 20 or 12 hours, and gives guidelines for supplementation of feeding, for medically indicated supplementation. If you haven't seen this before, it was very difficult to find. So if you haven't seen it yet, the URL is there for you, and I would really encourage you to look at it and to consider using this in your practices. Our pediatric hospitalists are very aware of Stanford guidelines, and this has really helped us prevent overfeeding and also using alternative feeding methods when medical supplementation is indicated. Next. This is a formula huddle sheet. We actually adopted it at Fairview from one of our sister hospitals, Hillcrest Hospital, and this is a huddle. If you're familiar with huddles, I'm sure you are, where our charge nurse, the couplet care nurse, and a lactation consultant get together and talk through before a first formula supplementation is given. So we use it with the exception of hypoglycemia issues. Certainly would never delay treatment for hypoglycemia. But we talk through what the reasons are for the request. Is it a maternal request, like a non-medically indicated request? Is it a medical indication? And then what are our options? Can we offer expressed milk? Can we utilize alternative feeding methods? We also use the newborn weight loss tool, if you can see on the upper right. Next. So the newborn weight loss tool is from Fleerman's newborn weight loss study, and it was a large cohort of racially diverse population with multiple hospitals, and it shows a normal range of expected weight loss by the hours of life of the newborn. If you've not seen this study yet, you really want to find it as soon as we are finished. It differentiates between the method of delivery, and it is a nomogram type process. So Fleerman said, our results show that weight loss greater than or equal to 10% of birth weight is common and often occurs earlier in the postnatal course than previously documented. These nomograms provide normative data that may inform clinical care. Next. So, from Fleerman et al. Study, the Penn State Health Children's Hospital, along with the Children's Miracle Network, Kaiser, and Banoff Children's Hospital in San Francisco, supported the development of this newborn weight loss tool. And you can see that weight loss is charted, the infant's weight is charted at hours of life across the horizontal bar, and the percent of weight loss is documented. And so these are plugged in. This can be done, it can be downloaded and put on your desktop in your nursery area or your nurse's documentation area. You also can, and so you can see that weight loss, this study actually included, I believe, 225,000 infants. It was a large study, and it looked at, was a very well done study, and I would really encourage you to read through it and consider the use of this in your practice. Next. So it's also available in a downloadable app, so your hospitalists and pediatric providers can actually download it to their smartphone and use it when they're looking at infant weight loss. And it will show you know, the ranges, it's done in a nomogram fashion and very, very helpful in deciding whether medically indicated supplementation is needed for an infant. If they're falling out in that 75% category and not latching well, then certainly there are some things that need to be done. So I really encourage you to look at this if you haven't already been using it. Next. So we have measured and reported our progress regularly, and I encourage you to celebrate small successes, that small incremental improvements will occur, and every step that you add in the 10 steps improves your outcomes. Use Ohio First Steps as the stepping stone to baby-friendly hospital designation, and there are many hospitals now who can help you and give you ideas to increase your exclusive breast milk feeding. If you look at this graph, I'll just say to you that from 2014, this graph represents our 4 maternity hospitals at the time, and it's a cumulative graph, and it's done quarterly, so you don't have the ups and downs of a monthly breastfeeding exclusivity report with this. You can kind of see that slow, steady gain and kind of leveling off. So I really encourage you to look at trends and to utilize your documentation and business intelligence reporting to show your improvements in your outcomes. Next. So at this time, my presentation is done. I actually did it on time.
You did. Thank you so much, Coe. There was one question. This is Jennifer. There was one question chatted in which would probably be pertinent to answer here more immediately. Was somebody asked if you use the huddle plan for supplementation with the late preterm infants as well?
I think that I mean, it might be discussed, and I think it would depend on infant vigor and like latch, so, and whether the mother was a primip or a multip. We would look at a lot of different factors, and the huddle sheet could be used in that way. We always want to avoid unnecessary formula supplementation, so we would look at the whole picture. And that's why bringing the lactation consultant into it can be very helpful.
Okay, thank you.
And that would be in newborn. I mean, if a late preterm infant is in newborn nursery, we know those babies are more at risk, and that's where those Stanford guidelines would come more into play. And so the huddle sheet, all of those tools at the end of the program, none of them are you can't use one. You know, you have to think about it in terms of different tools. Each tool is just one way to assess whether an infant is doing well or needing additional fluid supplementation and, you know, the whole picture instead of just a quick thing made on a wet or a stool determination. Does that make sense?
Yeah, that makes very much sense. So yes, no, I appreciate you bringing that to light. If everybody could chat in other questions, Ryan will, I see there's one other one there already, but Ryan will kind of compile all those at the end and combine some similar ones. We have 2 more things to talk about real quick, but Coe, definitely stay on the line. We will circle back and answer. I know there's a few other questions that will. Yep, we're already getting other questions in. So we will answer those
Great.
that we have time for, and then we will also compile some of the questions onto a FAQ page on the website to answer questions even after the fact here. So thank you very much, Coe. This was very, very helpful. And
Thanks,
I want to thank you. I want to introduce one of our next speakers with just a quick little 2 or 5 minute update from the Ohio Breastfeeding Alliance. And I have Lori Nestor, who's going to be on the call today. She has been a dietitian with Allen County WIC for the last 20 years. She's the breastfeeding coordinator there and has been for about 15 of those years. She's active in her local and regional breastfeeding coalitions and lactation networks in Northwest Ohio. She's been an IBCLC since 2011. She's active with the Ohio Lactation Consultant Association and currently serves as the Northwest Regional Representative. She's also active with the Ohio Breastfeeding Alliance and currently serves on the leadership board as the Region 3 representative, as well as the chair of that organization. She's from Bluffton, Ohio. And Lori, would you like to update the people on the call today about the resource database that OBA has available on the website?
Absolutely. There's a screenshot that has our website address at the top, and if you look under the breastfeeding resources, you can find a database that we are still somewhat pilot testing. Things show up from time to time that we have to figure out how we want to handle, so it is still a little bit in draft mode, but we're pretty happy with how it's working so far. This is a project that was identified by Ohio Breastfeeding Alliance, but really the focus and the the impetus for getting it off the ground fairly quickly came from the Breastfeeding Coalition in the Cleveland area. They wanted to have something that lactation consultants and other medical providers could help moms and families find breastfeeding services in their area, and looking for something that could be interactive and easy to see even across the state. And I know in my area, especially when we have babies that are delivered in Columbus or Cleveland or Toledo, when they come home to a local area, the lactation consultants from those larger hospitals are often looking for, what are the resources especially when there's more rural areas and there are not as many medical facilities, what are the resources available to the moms for further follow-up. So we came up with a database that you can either enter a zip code or you can click on the map, and it will pull up what is in your area. Many of the things that are there currently are entries that were put in initially by the Breastfeeding Coalition in the Cleveland area, and then we've also worked to encourage other WIC clinics and some other through the Ohio Lactation Consultant Association to get other facilities, other hospitals, other support groups, other venues added. And one of the things that we wanted to do today was give an invitation for all other hospitals to add their services as well. And at the bottom of the map there's a link where you can either edit information that's existing currently there, or if you want to add your site and add new information, you may add your information there, and we should be able to get it incorporated into the database fairly quickly. It's not an automatic, it's something that we have to process and add, but it's something that, we will make a priority to get things added pretty fast. As you can see, we selected one center just to show how things are featured on the website. This shows Atrium Medical Center. If you look on the right side of the display, the locations there that pull up are all the lettered locations. It shows kind of how many miles from, where you clicked on the map or the zip code that you've entered. And then in the gray box, it'll give the information that was supplied for that facility. And we're trying to make this fairly easy to maintain. So we're asking for location information, contact information, whether that's a phone number, your website, a Facebook page, whatever you want to use for contact, and then a brief description of what services you offer. And then our hope is that people will then, use your contact information to find out the more detailed information about times, locations, things about scheduling if that's an issue. And that way the Ohio Breastfeeding Alliance does not have to constantly be, trying to make sure that your information is updated. As I know in our area, locations often change, times change, a meeting gets canceled because of weather. We don't want to be responsible for that kind of information. So we're trying to get the location and a general idea of what is available out there, and then people can make further contact for those sorts of details. I think One suggestion I would have is that if you give a website, is to make the website link to your actual page where you describe your lactation services. There's a couple that are in there currently that give just the main hospital web page. And sometimes it's really hard to find the breastfeeding information on hospital web pages. So that's, as more hospitals are looking at baby friendly and Ohio First Steps, I hope that's something that they make sure is kind of high on the list, is that if I click on my hospital website, can I find where the lactation services are, and you know, what they provide, because I know myself, it's when I look, sometimes it's difficult. So we encourage everybody to add their information to our website, poke around and see what's on the database, and look at the other materials that we have offered through Ohio Breastfeeding Alliance. We are the Ohio's statewide breastfeeding coalition. We encourage anybody to join and become a member. The fee is only $10 for the year. We've kept it a very low cost. We are developing other resources on just other topics in breastfeeding and lactation, such as nursing in public. We have some people talking about how to provide more information for moms who are needing resources for childcare providers. And we have a lot of other information on our website as well.
Great. Thank you so much, Lori. And I'm going to fly through these next slides super fast because we have several questions that I want to make sure we allow time to get to. But I wanted to let everybody know that the Maternity Care Best Practices Award for this past year, for 2016, the application is going to be up on the website today, I believe. And I think that's on the next slide. And this is the Maternity Care Best Practices Award, is the award your hospital can apply for if you are bag-free, meaning you do not distribute the free infant formula samples from the formula company that comes in diaper bags or other things like that. So this is to help you start to align towards more of the practices with baby friendly. We had a great number of participants last year, and I know a lot of people are asking about that. So that will be open today and is due on February 15th. And there's some optional information on there this year just for data collection purposes. And if you want to fill those out on the SurveyMonkey, that would be very helpful as we look at planning educational sessions and where to go next with some of the First Steps programs. There is a difference between being bag-free and code compliant. Code compliant is an additional step and has more steps to be compliant with the code for marketing breast milk substitutes, but this is just a way to get you started on the code compliance pathway. This is a picture of some of the awardees from last year that we plan to distribute the awards again at the OLCA annual conference, and that is March 17th and 18th in Columbus, and those awards will be given out at that time. 52 hospitals from the state were recognized last year at that conference. So I see, Ryan, there were several questions that were chatted in so far. I encourage everybody to chat in further questions. And do you want to pick a question, Ryan, and have, looks like most of these are for Coe. You want to have her answer some of these?
Yeah, I guess we'll start here at the first question we got in, Coe, was what incentives do you offer prenatals for education?
Can you repeat that, Ryan?
What incentives do you offer prenatals for education? I assume it's your prenatal clinics.
So this was in one of our at-risk clinics. Some of our moms are homeless. They don't speak English. Very, very at-risk population. And so when they were able to come back and answer questions about the importance of breastfeeding and different, last position, hand expression, those types of questions, we would give them a coupon for parking at the hospital, or a small pack of diaper wipes, a pack of diapers, things that were low cost and readily available, but that would be important for the moms. Possibly a cafeteria coupon.
Okay, thanks. The next question is, understanding that labor is often not natural and are medicated in some way, what limit do you put on time between feeds in the first 24 hours when following on-cue feeds?
When we talk about on-cue feeds, we're looking at a lot of different things. We're looking at gestational age, late preterms. We're going to be a little less less lenient on, but we're basically letting the baby drive the feeding. We're teaching the parents to watch for cues. We are trying not to put time limits on, and to encourage the family that 8 to 12 feedings is normal in the first days, and that we are not limiting with healthy, vigorous term babies.
Okay, thanks. One of the next questions, we would like to know how formula feeding mothers are instructed about amounts. The hospital says we now have a policy of feeding ad lib and would like literature links to start a conversation with our pediatrician. That's
a really good question. I know one of the important factors of baby friendly is that mothers who have made an informed decision to formula feed are taught safe formula preparation and also safe bottle feeding. And more recently, we're being told that Baby Friendly wants to hear that we are teaching parents to use eye contact with bottle feeding, close contact, and let's see, there's a third thing. Eye contact, close, hold them close.
Feeding cues and satiety cues, is that what you're thinking of? I think
you're right. Yes.
Yeah.
Thank you.
So the Baby Friendly wants you to teach all babies feeding cues and satiety cues, regardless of feeding methods. So
right.
So that does help that you don't have to feed them a certain amount.
I don't. You know, to be honest with you, I am not the formula expert, but as far as amounts, you know, I think because we started using the Stanford guidelines and looking at the actual size of the stomach, our nurses got used to the fact that 15 mils was like more than enough for a first feeding. And I think that our nurses have started to maybe put half an ounce into an extra bottle and not hand the parents a 2 or 3 ounce bottle with a nipple on it for formula feeders. So I'm not answering your question very well, but I know that our practices have changed.
And this is Jennifer, and I know at our hospital we have a separate handout that we developed for bottle formula feeding mothers, and one of the first things we put on there is how often and how much should my baby eat. And then it's the same thing. Babies, you know, formula babies feed about 8 times per day, and it goes through the hunger cues and satiety cues with that as well. And then our nurses do have they had little badge holder things that had a marble on it talking about stomach size and frequent, and that was just a visual cue so that they could discuss that with the formula feeding moms. And we've heard that from several other hospitals that have been in the baby friendly process. So that was a great question. We do want to make sure that our formula feeding families get accurate information.
Absolutely. And I'd love to share with you on that, because that sounds like a great thing. We were so focused on making sure that they know how to do it safely that we haven't addressed that yet.
And Coe, would you be willing to share the huddle tool? And would you be willing to share your scripting? We have a resource page on the Ohio First Steps, and I think those 2 items would be very helpful.
Okay, I will check about the huddle sheet. I'm not sure if it's considered proprietary,
okay,
but I will definitely check with my director on that.
Okay, great. Thank you.
And certainly the scripting, yes, we'd be glad to do that.
Okay. And to continue the last question about formula feeding, Libby from UH in Cleveland shared that they also teach paced formula feeding to mothers and babies at UH McDonald's Hospital. So that teaching, you know, having the baby more upright with the bottle more horizontal, if you looked up paced bottle feeding, you would find some resources on that, which is important.
Exactly.
Okay, great. Well, I'm not seeing any other questions at the moment. Actually, it looks like we have one person who's raised their hand to ask one final question. Let me see if I can get them unmuted here so they can ask their question. If I can find them here. All right.
Hi, it's Sandy. Can you hear me?
Hey, Sandy. There we go. I was trying to find on the list.
Hey, Sandy. How are you?
Hi, I had a question. I put it in chat, but it's not showing up. Thank you, Coe, for the talk. It was wonderful. Do you have a recommendation for who handles trying to figure out fair market cost for formula with the companies? Did you have purchasing do this when you went this way? As they handle, negotiate all purchases, or did?
No, we worked really closely with our purchasing agent, and I actually have done all of the fair market value calculations for Cleveland Clinic and the shopping that went with it since we started this. So we have to do that every year.
Okay.
And it is quite a process. And I think Baby Friendly is in the process of changing the requirements in the past year or so. They actually have adjusted it a little bit. But I'd be glad to talk to you about it. And it does take some time to get done, so don't wait till the last minute on doing that. And also, the recommendation of the Baby Friendly organization is that purchasing formula is one of the last things you do before a designation visit, so that you are not paying for formula for a long period of time before you have to do that.
We knew that we'd have to put it in the budget in advance, though. You have to put it in for the whole year.
Sure.
You make a change.
That's true.
Our director just wondered about it, and I thought maybe I'll talk to you offline about it.
Absolutely, and I will say that the formula companies, I remember one of the hospitals that was in the NICHQ grant program actually had to give up their grant because a formula company went to their administration and told the administration how much it was, how expensive it was going to be for them, and caused them to have to give up their grant, which was very sad because there is no, the formula companies are not accurate in their expectations or their projections of cost. So it's a real, it's just another manipulation. So.
Thank you.
All right. Well, seeing as how we've hit just about 1 o'clock, I know we're wrapping up. So first I wanted to say we did skip over the last few slides of Coe's presentation, so she did put in tons and tons of resources. So they should be, all those links and resources are on the slide decks that were sent out and posted. So I wanted to make sure we did highlight those because she did list several slides of resources for everybody. I want to let everybody know you should have in your calendars to save the dates for our upcoming call in February. We're going to be featuring Kim Marie Bugg from Reaching Our Sisters Everywhere, who's going to do a presentation about disparities in breastfeeding and things we can do to reduce the disparities here in Ohio around breastfeeding. But I wanted to send a huge thanks again to Coe, Linda, and Jennifer for their time and expertise today. Please keep an eye out for more information from the First Steps program. I know I send you guys a ton of emails all the time about upcoming materials, webinars, and additional opportunities. I will post this link for the Ban the Bag application up to the First Steps website as soon as I can, and that'll also include the slides. The recording will go up at the beginning of next week, probably, and so we're very excited about the things that are coming up for this year.
Hey Ryan, can I throw one more thing in?
Yeah.
When you said Kim Marie Bugg is going to speak, one of the most profound things I heard at OLCA this past summer was that the Baby Friendly Initiative is equitable healthcare because it puts steps in place that are applied to every mother. And so every mother, there are no preconceived thoughts about people based on race, religion, culture, and it is equitable healthcare.
Yeah, thanks for bringing that up. Yeah, so with that, I think I'll say I'm very happy we successfully made it through a webinar scheduled on Friday the 13th. I probably shouldn't have done that, but we made it through. So I want to thank everybody for being on the call today. Thank Coe and Jennifer and Linda for being with us today. So everybody have a great afternoon and a great weekend, and we'll see you on the next call.
Great. Thanks, Ryan.
Thank you.